name is Helene Iser. I'm the director of the School of Nursing at McGill University. There are a lot of things that are going on in nursing in the province at the moment. I think the things people know most about is the fact that there seems to be an absence or a lack of number of nurses to meet the need. And that's true. At the same time, nurses form the largest core of the healthcare system, the largest manpower core in the system. And they're everywhere. Basically everything that happens in healthcare, in one way or another, gets connected with nursing. So not having enough nurses isn't just a matter of the delivery of care in one area. It matters across the board.
My name is Sean Clark. I'm the director of the McGill Nursing Collaborative and the holder of the Susan E. French Chair in Innovative Practice and Nursing Science. I think that in healthcare around the world, we're seeing a need to bring access to services to a higher level, questions about whether we have enough people to provide the right services. I think it's access, it's about the quality and safety of care, and it's about costs, frankly. And I think nursing has a lot to offer in terms of how we can do care better, I guess, how we can deliver services in more innovative ways that meet the public's needs. And I think the projects and initiatives in the collaborative are going to help generate some new solutions, I guess, take a new look at some long-standing questions and provide some opportunities for targeted populations to do a better job with this.
The collaborative is a project that was put together between two hospitals and the university. And it entrenched a practice that we had developed to enable our graduate students to take on and finish research projects, nursing research projects, in a timely manner.
Well, already we have an extensive package, I guess, of collaborations in place between the master's program, especially the graduate program, but the master's program more specifically, that connects clinical experts with researchers and students, brings them together when they have interests in specific clinical populations, like mothers and babies, or kids in the intensive care unit, or cancer patients. And so that the student doesn't have to come in cold, the student gets some guidance and helps to create a question in a project that they then work on through over the course of their master's training. And that program is running incredibly well, has a great track record both of giving students hands-on skills in sort of working with others to solve problems and to create new opportunities in clinical care. But we're going to strengthen this, and we're going to, I guess, make it larger in terms of the supports that are available and the number of students who can be accommodated.
What we are doing is we're preparing leaders for the profession who understand what research is, what innovative practice is, and what are the conditions that you need to set to be able to do that.
I think there are a lot of solutions. I think that nurses, because of their close contact with the delivery of care, have lots of opportunities, lots of perspectives on good ways to meet patients' needs. And I think sometimes they haven't in the past necessarily always had the way, the settings, the opportunities to stand back and to take a look at what those opportunities might be, to create new ways of delivering care, and then to test them out, because the testing is incredibly important, because a lot of the things that we do in care have never actually been tested.
Why are we doing this treatment we've done for years? On what basis are we doing it? Often there's no empirical reason for things that either nurses or physicians do. But no one takes the time to say, well, hey, what would be the right thing to do? And so all of these are exploratory projects, exploratory research projects for changes in practice or changes in the way in which you decide how you're going to give heparin. Everybody gives it differently. There's these kinds of ways of dealing with care need to be based on real understanding, real knowledge that you can back up.
Change and innovation are great, but we need to make sure that we're going along a path of taking ourselves towards better quality healthcare. And I absolutely believe the collaborative is about giving new opportunities for students to be educated in a really proud clinical tradition that emphasizes putting patients first, to learn about how we ask questions and do research to make care better, and then also to put the clinical agencies and the people who are delivering care on the front lines at the heart of generating new questions and to give them a chance to play an even bigger role in the shaping of the next generation of caregivers and leaders in the profession.
It's not the kind of thing people do anywhere. The reality is that institutions tend to work in isolations. They have enough on their table in a hospital that they really do not need to know what the university does. And that's the way it is in other places. And they just sort of hope that when you generate knowledge, maybe somebody will pick it up somewhere. But that doesn't always happen.
One of the flavor of some of these questions, and a really important starting point, is regardless of if we can pick any clinical population, people with diabetes, parents of a prematurely born baby, cancer patient, what do those patients and families really want out of their care that can become a starting point for designing good care that addresses their needs more clearly? That is a very important starting point. We take data from studies like that, and then we figure out new ways to use nurses within the context of the team to make that happen, and then we test it out and we see whether we actually did make things better and we did respond better to needs.
For the students, it meant that they had clinical research projects. They could pick one that was meaningful for them. For the clinicians, it meant they had a thing that's been bugging them for ages, they've been wanting to do, but just don't have the time to do. But we already know that this kind of an arrangement or an agreement is resulting in changes in care. It's resulting in different ways of helping people manage their cancer treatments. It's helping to develop information programs that are particularly relevant to, for example, parents who are leaving with their first child.
In terms of where Montreal is placed in the nursing community internationally, I think we can talk about how the collaboration between the University School of Nursing at McGill and the partner teaching hospitals is really exceptional in terms of people being on the same wavelength about what good care looks like, and in terms of the importance of supporting each other and getting to the goals of great patient care, great education, great research. That is something that's really exceptional. And we are producing large numbers on the University of Montreal side, large numbers of excellent clinicians, excellent researchers. And it is the University of Montreal and its affiliated institutions are where the Francophone world looks to in the profession. So I think there are incredible potentials to make closer links between, the two sides of the mountain, as it were, but also in terms of larger impact internationally, which is definitely one of the donors' visions. I think there's a lot to build from here.
So we're hoping that the collaborative, with the addition of a chair and monies invested in being able to go forward, that the projects will become larger, that they will become stronger from a research point of view, and that there will be interinstitutional, not only between one university and another, that it'll be shared projects that make a difference for care everywhere.
I would like to see, for starters, I'd like to see us really put out there some of the successes that we already have in Quebec healthcare in terms of delivering good service to the public, to sort of claim some of those successes. I think in healthcare we tend to sort of focus inwards on the business that we have to do on a patient by patient or student by student business, but the big picture questions of access and cost and quality are with us all over the place, all over countries. I've taught in the United States and in Europe, and I've collaborated on research projects all over the world. It's the same fundamental questions. I think that we should be recognizing our successes more, things that we do well in the Quebec system, but we should be exporting some of those successes, I guess, and helping researchers and educators and clinicians and their leaders around the world with that. But I also think that there are some interesting developments that are happening elsewhere in the world, and I would hope that in 5 years we'll be seeing a lot more movement of people and ideas back and forth in and out of the system that will translate to better care for patients across the range of settings that nurses are working in.